Hello, everyone, and welcome to today's discussion, Building a More Playful World, How Humor Can Bring Social Change. My name is Silvia de Faveri. I am the Research and Learning Manager at Red Noses International. Red Noses is an artistic organization that provides mental health support through artistic interventions in order to bring humor and laughter to people in need of joy. I'm truly honored today to guide you through this conversation. This year's theme reminds that mental health doesn't exist in isolation. It is shaped by our social relationships, our environments, and the kinds of support and care we have access to. Today, we're focusing on one often overlooked yet powerful dimension of that support, which is humor, play, and artistic expression. Together, we'll explore how humor and artistic interventions, like healthcare clowning, for example, can reduce anxiety, build trust, promote healing, and also foster inclusion. We'll also reflect on why access to these experiences should be seen not just as beneficial, but as a fundamental social right. I'm thrilled to be joined today by three wonderful panelists. We have Anamarija, Jurišić, Osmeričić, healthcare clown, artistic program manager, and crisis response specialist. Hello, Anamarija. We have Jutta Tomandl, child and youth psychiatrist and psychotherapist. Hello, Jutta. And we have Liuska Sanna, head of operations at Mental Health Europe. Hello, Liuska. Each of them bring unique insights into how playfulness and creativity can have an impact. So with that, let's dive into our first reflection. And I'm going to start with Anamarija. As I mentioned before, she is a healthcare clown, artistic program manager, and crisis response specialist. So, Anamarija, welcome.
Hello.
Great to have you.
Thank you for calling me.
Yeah, our pleasure. So my question for you is, when you introduce playful clown-based activities in hospitals or, for example, care homes for older adults, what immediate changes do you observe in patients or in the staff?
Well, clown artist, when we come, the immediate change that you can see is the space and the atmosphere. There has never been a place where I came or my colleagues came and that you don't see at least this moment when everybody looks at you. From that moment on, you can see the change in the posture of the person or the child or the staff or the mother and father. But also you can see the change in the eyes. You can see change in the breathing, which is like the first thing which you see body-wise. And then as we go and continue with the clown, you can see the change of dynamics in the rooms. You can see that there is now a place for everybody to be. Like every generation is now connected because everybody is connected through the clown. So those are the first facts that you really see when you enter any room or any institutions. What you usually see afterwards is the beginning of breathing, because you can't laugh before you take a breath. And that's the power of clown, because even if somebody gets scared, he needs to breathe. So after this scary moment, the breath comes and usually the laughter comes. So from this point of view, that being a clown is like being this possibility to change atmosphere and breathing. And by doing that, you can see the change in the whole surrounding of the institution. After the child starts to breathe, the mother and father starts to breathe. After the mother and father starts to breathe, the medical staff can start to breathe. So it's like a chain reaction of possibility to release the tension which is among them.
Wow, thank you so much, Anamarija, for putting it so beautifully. it's always nice really to be introduced into this magical world of the clowns and really see, how things change from your perspective, as an artist. So thank you very much. Following up on that, how do you think that these experiences highlight the idea that psychosocial care is a fundamental social right?
Well, I remember one time we came to the operation ward, and there was a little boy who had a big accident. So he was for a long time in the hospital. And we were visiting him for quite some months. So we started when he was not able to really see us because of the accident. So maybe he hear us. He was unconscious. So we knew that by music and by playing and by coming there for him and his parents, we will change something. But we started very slowly and easy. And as the months grew and passed, he woke up. We were so happy. Everybody was happy, of course. And then we started to get like the first reactions from him. After almost 6 months that we have been visiting him and that he was on and off the hospital, he came one day and we were playing, and one of my colleagues like stood the hands up and started some movement, and the child did the same thing. Of course, for us, it was like amazing because he was with us, he was dancing, he was playing, he was really engaged into the clown play. But what we find out later was that the mother and father, in that point, when they saw his hands up, they were completely, what happened? Like they were astonished, they were crying. We saw 1,000,001 emotion. And after that, we found out that he could not do that move from the point when he had the accident. So this was the first time he really managed to do it. Why am I telling this story? Because in this period, when we were with him, not only with him, but with all the children that were on the operation ward, we allowed them to be children. And I think that's the fundamental social right for every child, but also for every adult, because all of us, we were children once. And because clown can feel all the emotions, but also clown can be there for all the emotions. Like we are there when people are crying, we are there when people are laughing, we are there when people are sleeping and just hearing our voice. We are allowing all the emotions which are usually regular outside the hospital to happen inside the hospital. It can be go out from my room, but finally I have the power to tell somebody go out from my room, because what I see is that when you come to the hospital, you come to the place where you will heal, but also you have to obey the rules. And sometimes you are so long in the hospital that sometimes you lose yourself and you become your sickness. Clown and clown artists, we don't look to the sick point of the person or the child or the magical world of healthcare, which is happening like very routine. We do this, we do that. We are looking for this spark in each person, and each person has to have this possibility that we can be ourselves no matter what is happening to us. The child can stay child no matter that he or she is in the hospital.
Anamarija, thank you so much. This was a truly moving story, and also thank you for packing so much information, interesting information into through one episode. We spoke about the impact that you had on, for example, on this child, but also we spoke about this chain of events, so how you not only change, let's say, the mood or the well-being of one single child, but also of the whole environment around you, the staff, the support system of the child. So it's really this effect that I'm so grateful that you were able to highlight so beautifully today. I just would like to know if any of the other panelists would have anything to add about this.
I'm happy to. I think there are two things that struck me in Anamarija's contribution. From everything she said, what I kept thinking about was connections. So this space you create, which really connects the children, the parents, the staff, and then the connection you, clown artists, have with the children and all of them. And connection are such an incredible support for good mental health that we really need to think about to build these connections and strengthen them. And I think the other aspect, which is really key in our approach to mental health, is what you said. In hospital, you become your sickness. And this is what happens with mental health. People get identified with their problems. And that's not the good way to look at mental health, because mental health is part of us in the continuum of our life. And we have good and bad moments across the life. So people shouldn't be identified with the problems related to the mental health. Thank you.
Thank you so much, Liuska. Yes, absolutely.
Yeah, I can only emphasize what you two said, actually. And so I would say one part is really, no matter what is happening in the hospital, what sickness is there, to create beautiful moments. Yeah, moments they can remember, they are fulfilling, where they don't have kind of an aim or a must do. They are creating itself in the moment. And then there is this feeling of surprise, of wonder, of laughing, that also can come spontaneously. And then they can look a little bit differently also into the world. Okay, there's not only problems, there's not only happiness, there's still something else possible. And there's still healthy parts in myself, let's say, or in the patient. It's like it's one story came in my mind when I was as a clown in the hospital. There was a very sick man. He had liver cancer, and the family was with him. And they told us that he loved to sing and play the guitar. So we invited him to play the guitar, but he was already very weak. Nobody thought about it, that he could do it. But he really got up and played a little bit, and he couldn't sing anymore, but he was humming. So that was so touching for the family that they started to cry. And it was like, oh, there is still the person, even he's dying, there's still the person we know. So, and I think that's really the power, the potential of healthcare clowning, and also for the mental health, that gives hope and and the chance of beautiful moments, even of feeling sometimes of helplessness, let's say.
Absolutely, Jutta. Thanks again also for this beautiful example. And maybe if that's okay, I would like to stay with you and I would like to talk to you a little bit. I have a question for you too. Let me introduce you again a little bit. Jutta Tomandl. Jutta is a medical doctor specialized in child and youth psychiatry and psychotherapy. She's also a psychobody therapist and an healthcare clown. And my question for you, Jutta, would be from a psychotherapeutic standpoint. Why do you think the playful interventions are so powerful for children who have experienced, for example, trauma and stress?
First of all, maybe like to feel a little bit into a child who has experienced trauma. What resides in them are kind of difficult feelings, like a lot of fears, or sometimes a feeling of stuckness or freezing, or that they always have to take care, am I secure? Like in this kind of state of fight and flight modus. And of course, our experiences have an impact how we see the world. So it can also happen that they have a lot of mistrust in the world or in other people.
Yeah, sure.
So with a kind of playfulness, it opens up a space where on the one hand, they can play out the feelings, also the difficult feelings, without the danger of hurting them. It's like it's a play. I play a situation like it's real, but I have this safe space of play, this protected space in a way. And at the same time, also when we look at the origin of play was something very important for our development, because there we can try out different things. We can fail and try out something new without any consequences. So that's something they enjoy. And then suddenly something new can happen, because it's important that they also know, it's not only this way, like I experienced it in the trauma, or like they have it in their survival strategies. It's also like, there are, as Anamarija also mentioned already, other possibilities. Okay. So, and there are different people, and it doesn't have to be always like that. So, and they can find a place of security. And it's also said there is this polyvagal theory, like to really get into the connection again in this social state, that you come out of this fight, flight or freeze modus. It's important to have a connection, to so that you get in a social engagement, that you make a story out of it, let's say, where they can be the hero again. So, and there the playfulness, and you need this inner attitude, let's say, as a psychotherapist or as a health caretaker, to allow it to happen, to sometimes maybe get a little bit crazy, or try things out, or to, like what they're afraid of, to exaggerate it, to break taboos, but of course in a very compassionate, careful way.
Thank you, Jutta. Do you maybe have another example that you could share about this?
Yes, there are actually many examples. Maybe I tell one about the exaggeration. It's also kind of, let's say, clown tool, or to put contrast. For example, I had a girl who was very afraid of aggression, but also aggression in a positive way, like to say stop, or she had a feeling of guiltiness very easily. So, for example, when she told me a situation, I was kind of exaggerating how to also be possible to answer to the situation. Yeah, in like not in a very moral way. Yeah. So she was laughing. It kind of released her tension. Yeah, it was like, oh, okay, no, I'm not that bad. So I can trust myself. I would never come to the idea to do it that bad. Yeah. So, okay. I mean, I'm really okay. So there was this relief, there was this laughing, and so she could, on the one hand, connect to herself again as well. Yeah.
Sorry, go ahead, please.
Yeah, it's just like, I think it's also like a matter of trust again. So when they have had very bad experiences, and there is laughing, there is humor, there is also lightfulness. Of course, not only there are these difficult feelings, but it's, of course, for them, it's like, okay, there is still something good, something beautiful in the world where I can rely on, where I can trust, also in themselves and in their surrounding. Yeah.
Thank you, Jutta. It was also super interesting to hear very moving, of course, and very interesting to hear also how clowning really helped create this safe space, and also it really helped children to explore all the range of human emotions, you know. So how they can really explore, you know, how they feel, how it could be, how things could be different, how they can create a different scenario, you know, for their life, for the moment, you know. So that's really beautiful, and it resonates also with what happens in our emergency smile missions when our clowns go to in humanitarian contexts and work with people in crisis settings. So, for example, people involved in migration. And there you can really see how the clowns try to create a safe space for the children to express themselves, to feel children again, to really explore all the different range of emotions that they have been feeling, you know, in the past months through their journey, through difficult times. So thanks a lot for sharing this. And maybe also some of the other panelists have something to share about this.
Yes,
Maria.
When yesterday I was playing for the children with the autism spectrum, and after the play, the teacher came and she said, like, they have never been sitting for this long. They were so focused on you. And especially for one child, she said, I think he never saw any kind of an art in his life. And I was like, wow. And then to listen to you, Jutta, it came to me that psychosocial care is not an extra. It is the most important thing, which has to be combined with the care for the body, because if these two things is not coming together, then something will go wrong. And as the humor says, humor is the fluid in our body which needs to be in balance. And if our body is in balance but our mind is not, or other way around, we will not be good. And I think that art can really help in this combination of psychosocial care, of the care for the body, and also the care for the soul and mind.
Thank you, Anamarija. And actually about this is really very much in line with the WHO definition of health, right? So health is a state of complete physical, mental, and social well-being, and not only the absence of a disease or an infirmity. So yeah, well said. It's really about looking at health in its whole, you know, in its entirety, let's say. Thanks a lot, Anamarija. Liuska.
I thought I would just emphasize what was said a few times, like safe space, because when you're experiencing mental health problems, part of it is the feeling of being alone with your problems and also not having full control of your life. So anything that can contribute creating safe spaces for people to work through their issues is an incredible support. And I see playing, creative expressions, laughter, art and culture as a really important tool to contribute to that. So, and the testimonies from Anamarija and Jutta really support this. So
yeah, that's true. These examples from the field, let's say, from lived experiences are so important also for everybody to understand what happens, you know, in, on the ground, let's say. It really helps us better contextualize a little bit of the power of laughter and humor, you know, in everyday life of people. So thanks a lot. Liuska, I would also like to stay with you this time because I also, great. I also have a question for you, but before, let me introduce yourself. Let me introduce you again. Liuska Sanna is the head of operations at Mental Health Europe, and Liuska has more than 20 years of experience in rights-based international and European networks, mainly in the health sector, and also in organizations focusing on children's and women's rights. And Liuska, I would be curious to hear from you the following question. I have this question for you. So Mental Health Europe actively promotes the psychosocial model of mental health. How do you think art, culture, and humor programs fit within the model?
So, well, first of all, it's important to understand what the psychosocial model of mental health is about. And it is basically moving away from the understanding that mental health is a problem of the individual and that it is linked to genetic or biomedical factors. So this model basically acknowledges that mental health is an aspect of every human experience and that it can be influenced by so many different factors, definitely challenging or traumatic life events, but also broader socioeconomic factors like, access to a good job, working conditions, housing, social security, and so on. And so prevention, support, and care related to mental health need to take into account this broader context. And it means that we actually need a collective effort to make these changes, and that changes need to happen at societal level. At the same time, this model says that offering people the right help entails understanding that the right help means a different thing to different people. So, for instance, recovery is a very personal journey, and it needs to include different approaches, therapy, peer support, inclusion policies, but most importantly, it needs to be based on choices, options, and control. And so within this context, arts, culture, humor programs need to be part of this range of options. And we know that the link between these and mental health is well established, because whether you are on the side of the creator or on the side of the recipient of the creation, creative expression is one of the ways we can communicate and express our most complex experiences. And we know that mental health is a complex, can be a complex experience. So again, playing humor, arts and culture can really help make connections with ourselves first, but then with the world around us.
And how do you think we could apply this model in practice so that it can be,
there are plenty of good examples in different sectors, because of course it can be applied in different ways according to the context and the realities of the context. But there need to be some common features that we have seen. And the first one, and I would say, I think the most fundamental one, is the respect of human rights. Because if an approach is really looking at the human rights of people, then there are more guarantees that is really responding to the needs of people. Another factor is self-determination, which means you have control on your own life and choices. And this needs to happen as well in mental health at the level of policies or legislation, whereas in fact often they discriminate people experiences mental health problems, but also at the level of services, and so that leads to the next one, which is equal partnerships. So too often we see the people supporting people experiencing mental health problems sort of try to seek control, but it needs to be a partnership. They need to accompany and to go along with the people and enable them to make their choices. Something else which is very important that has been mentioned, and we have seen so many real life examples, is lived experience. Mental health is linked to our unique identity and experiences. So there is so much to learn from people who have gone through difficult situations, who know how the system works. And this knowledge needs to be integrated in really looking into better mental health approaches and better mental health outcomes. And then holistic approaches. And this goes back to human rights and really putting people at the center. That means different sector, different professions, different services working together. So yeah, I would say these are some key elements that represent the red thread across this approach.
Thank you so much, Liuska. It was great to change the perspective maybe and go a little bit more at the almost systemic level to really see what could be done in society really, or what is necessary really to improve people's mental health. And as you said, this is really fundamental right for everyone, and it's important also. It's also stated in many different reports, publications of different international organizations. For example, a couple that come to mind are the Culture for Health report on the culture's contribution to health and well-being, and also the WHO 2019 report on the evidence of the role of the arts in improving health and well-being. And both these reports from international organizations, they really highlight what is the power and the benefits of artistic interventions, not only for the individual, but for the system itself, you know, for the public health system, because it supports a more empathetic caregiving system. It reduces health-related stigma, and of course, it improves communication between patients and providers, so contributing to a more empathetic, let's say, environment within hospitals, for example. So it really can have benefits at different levels, not only at the individual level, but really at the systemic level. And also there have been studies, there's evidence that says that artistic interventions in, for example, in hospitals can really reduce costs. And can reduce also the time of hospitalization of the patients. So these are really evidence-based facts, and it's important. And it's what's going to help us make the need for artistic intervention a fundamental right. We can really see its benefits. So thanks a lot about that. And I'm going to open the floor if anybody wants to add anything else, please.
Yes, as you mentioned, also this holistic approach, or also Anamarija, you already, that don't separate the mental health from the body. It's all connected, like we are all connected. So if one starts to talk about their problems, other people can find themselves in them in a way. So like over the briefing, we are connected, and this gives us so many possibilities to deal also with challenges. Like for an example, a clown's colleague, he's doing a lot of juggling, and he did an artistic workshop with traumatized refugees. So, and just with juggling on this approach over the body level, and let's say connecting the left and the right brain, this also had an impact on them to can relieve a kind of stress and see that another point of view without even really confronting the problem, but like starting a process that opened up resources in them to give them a possibility to see it differently. And then maybe they have a group session where they talk about things, and they're there in another state of mind, let's say, where they can see things differently. So, and this I like about it when it's getting so like a network in a way, yeah, so interconnected.
Thank you, Jutta.
Yeah, especially when we go to crisis response missions. I just came back from Ukraine, and when I saw that the children, they told us these children are all ADHD, So be prepared. It's going to be... And we came, and because we knew that we can bring this play to them, which can be also, we were calm in ourselves. And as Jutta said, it was collective, because the two clowns which came were calm, but also playful. The children could connect to that, and they really become calm, but playful. So everything what they told us, that we have to be cautious, that maybe they will be all over the place, they were not. They were really focused, because we allowed them to be focused, but also to play, to be here, but also to go. So art can really give to each person space for them. And I think that's the beauty of a human being, and of creating an art. And as we already say, breathing is the most important thing for all the people. But you can't laugh before you breathe. So this really helped us, even in this situation when you fell down on the street and you don't want anybody to see you, you start laughing, because laughter can also like protect you from the world. And sometimes I say we really bring hope, because in some people you will not see the laughter, you will not even see the change in the face, but you will see the change in the eyes, because they will go from this to just look at you. And I think that is the fundamental right for everybody, that he or she can go from this up, just to open up. And then from this opening up, we can start with everything, especially when we are talking about mental health problems, and especially when we are talking about mental health problems with teenagers or children, because they sometimes feel alone just by being themselves. And when they can really be themselves, when they can really share what they feel, they can open up. We have this special program, Circus Paciento, where we go to the children on the psychiatry ward, and we bring, like Jutta said, juggling and all the circus expertise that they can learn. And I remember once we were doing that, and the child was like, for 5 days, no, 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 when we were respecting that. And by that respect, that we didn't push, but we allowed that if he wants, he can try. In the end, on the final grande finale, everybody did the show, and he came like, can I do it? And we were like, yes, even though he never practiced anything, but we did it in that moment. We did what he can do, and he got the applause. So we allowed that child to be there and to go through this, what is Liuska saying, through this phase of accepting what is happening to him, and to go out from this cocoon.
Anamarija, thanks a lot. I think also if I can just add something else, I think what you and Jutta also mentioned right now, it's very important, and it connects to what Liuska was saying before in terms of self-determination. You mentioned the safe space. You mentioned the fact that artistic activities, healthcare clowning in this case, create this safe space where people can express their feelings freely. It's also about feeling in control of themselves again, especially in situations in which they feel they are at bay and they feel they are at the mercy of things that they don't understand, such as medical procedures, people that they don't know, like doctors, By focusing on them and creating this safe space, it's really an opportunity for them to reconnect a little bit with their emotions, with their agency, and it can be very, very empowering. And also, as you said, Anamarija, before about deciding to play or not to play, deciding to take part on the activities or not. This is really also about giving the child the agency to decide for himself, for once, in these complex situations in which maybe they have to do some medical procedures, they have to abide by certain rules, etc. You are actually giving them the opportunity to say no if they want to, or yes, and really feel again what it means to be in control of their own lives. So, and I think this links nicely to what Liuska was saying before about, being control, self-determination. This is really an important human right for everybody. So thanks again for that. We are at our last round of comments. And so I would like to ask you if you would like to add anything else to our beautiful discussion today. Now is the time.
Yeah, I would like to add like this form of human right. I think it's also like playfulness and humor is something very natural in us. It's already there actually. So where we give space, or like the safe space that it can be lived. So no matter what happened to you, everybody has the right to live a good life, let's say, and to at least create possibilities and have the chance to be part of the society and the world, and evaluate from the point where they are coming from, no matter if it is a minority, like people who live in an ethnic minority, or on, let's say, from the rich society. So there are no judgments in a way. So we meet each other as human beings with the rights we have. And then let's see together what what we can do together. Yeah.
Thank you, Jutta. Absolutely. This is, accessing artistic activities and taking part in play, being able to play and accessing cultural activities is really a fundamental right. And it's stated in different international reports and documents. For example, the UNESCO Universal Declaration on Cultural Diversity. We have the UNCRC, the United Nations Convention on the Rights of the Child. So it is actually stated in many different places, and it's important that every local government really start to implementing this in their everyday social systems. We shouldn't overlook this. So thanks a lot. Anybody else?
Yeah, I wanted to say like that everyone deserves the joy, the dignity, and every kind of emotional support. I think that's not just bonus, that's a human right. Yeah.
Thank you. Thank you very much, Anamarija. I will also add to that in a little bit. Liuska, please.
Yeah, two things. I think in a current context where there are so little resources put into health in general, but also mental health, and actually there are cuts, and health providers are under-resourced. And so there is such a big gap between the needs for mental health support and the services and the support offer. I see, playing, clowning, arts as a sort of, not easy, maybe it's not the right term, but like a very efficient way to provide help to people, because as Jutta said, it's in us. Playing is in us. Joy and laughter, it's already in us. So connecting to that sounds like one of the probably most direct and efficient ways we could use in this context. And then maybe I will close by stealing something that Anamarija said earlier, because it really summarizes my contribution earlier. She said psychosocial care is not an extra, but it's the most important thing. Thank you.
Thank you, Liuska. I would also like to add to that, actually, exactly what you're saying right now. It's not an extra. It is a fundamental right. And I think from my perspective as a researcher, research can really help making the case that artistic interventions have a measurable impact on people's well-being, but not only, they also have an impact on their support system, they have an impact on healthcare staff and on the whole environment and people within the community. There are numerous studies that have explained and analyzed how healthcare clowning, for example, can really lower anxiety and stress, not only in children, but also in the parents who stay with them at hospital, and how it has also improved communication between healthcare staff and the patients, how it has really created a more positive atmosphere in the ward, in the hospital ward. So yeah, there is evidence about this. And I think that this is really what we need also to make a case that artistic interventions are really needed, and they are a human right for everybody in need of joy. So at this point, I feel like we had such a rich conversation, and I'm really sorry that we need to wrap it up. I would like to thank you all for such a rich and inspiring conversation. Today's discussion has truly illuminated how humor, play, and artistic interventions are not just powerful tools for emotional relief, but they're also essential components of psychosocial care with real measurable impacts on health, inclusion, and also dignity. Thank you to you, all our panelists, and let's continue to build a more playful and compassionate world together. Bye for now, and thanks everyone.